Hello everyone, myself Shivangi Patel. I am from 4th year BPT. Today I am going to explain the difference between the institutional based rehabilitation, that is IBR, and community based rehabilitation, that is CBR. These are the two very important approaches in the field of physiotherapy and rehabilitation sciences. Let's begin with the IBR or institution based rehabilitation. This is the traditional and commonly known method of rehabilitation. In IBR, the patient visits a hospital, a physiotherapy clinic, or a rehabilitation center to receive treatment. The environment is professional and controlled, and care is delivered by the trained specialists like physiotherapists, occupational therapists, doctors, nurses, and other allied health staff. The focus in IBR is usually on individual care using modern machines and scientifically planned therapy protocols. Patients in IBR are assessed regularly, monitored closely, and managed using advanced equipment and techniques. This method is especially effective during the acute or early phase of recovery, such as after a stroke, spinal cord injury, surgery, or trauma. However, one major limitation of IBR is its cost and limited accessibility, especially in rural or remote areas. Many people cannot afford to travel long distances or pay for services in private institutions. Now, let's understand CBR, which stands for Community Based Rehabilitation. CBR is a concept introduced by the World Health Organization (WHO) with the aim of bringing rehabilitation to the doorstep of the people who need it, especially in rural, remote, or low income communities. It is a holistic, low cost, and inclusive approach that involves not just medical professionals but also family members, caregivers, community, volunteers, NGOs, and local leaders. In CBR, rehabilitation happens in the community itself, at the patient's home, local centers, or even in schools or workplaces. It is not limited to just physical treatment but also includes education, employment, social inclusion, and empowerment of the individual. The goal of CPR is not just to improve the physical function of the patient but to help them become independent and fully included in the society. While IBR focuses on professional equipment based care, CBR focuses on practical, home based, and community supported care. In IBR, treatment is planned and executed mostly by the professionals, but in CBR, care is shared and adapted with the help of trained family members and local workers, making it more accessible, sustainable, and cost effective. To summarize the key difference, IBR is suitable for intensive clinical rehabilitation that happens in hospital or rehab centers and is led by specialists, while CBR is suitable for long-term community-led rehabilitation that focuses on independence, inclusion, and quality of life using local resources. Both IBR and CBR are essential. Often a patient may start with IBR in the hospital during the early phase and later continue their recovery through CBR when they return home. So as a future physiotherapist, it's important for us to understand and integrate both approaches to give the best care possible to every patient no matter where they live. Thank you.